Hi team, today's Friday, week number 5, and we have ACL and the products. So ACL is anterior cruciate ligament. This ligament is in our knee, and we have the function of this ligament is to resist the anterior translation and the medial rotation of the tibia in relation to the femur. This ligament it's inserted in the medial part of the condyle of my femur, and it has two bundles in the plateau of my tibia, anterior medial bundle and the PL posterior lateral bundle. Now we're gonna go over the products, how we can fix when we have a torn ACL. We have the system from Cayenne. It's called the upper fix. So upper fixation, that's what it means. This product, the first thing, we will have to prepare the graft. We will have it from the hamstring muscles, which is the gracilis and the semitendinous. After we have harvest the tendons from, like, will be autograft, we will prepare it and put some suture in the end, pass it through our implant. In this case, this is our implant at 29 millimeters, and the suture, we will pass it through the cleats of our upper fix tool. So just simulating, this is our tibia and femur. We're gonna pretend this is our tibia, this is our femur right here. We're gonna drill a tunnel, the tibial tunnel, from our lateral side of a tibia, go all the way to the footprint where my ACL was torn, and we will follow it with another drill, with another type of drill to the femur. After we have the tunnel and everything is ready, just remember this tunnel wouldn't go all the way through the bone as other mechanisms will be cortical fixation, which this is not what we're working with. This is totally is very similar to the gold standard, the BTV. So what we will do in this case, we will go through the tunnel drilled, and we will make sure our implant is covering through, like, on the femur. Once we notice it just past that aperture, that's a perfect space where we have to leave it. We just want to keep it as close as we can to the aperture of fixation. After that, we will turn this clockwise. I'm not gonna do it right now. My device is not working for some reason. I cannot fix it. But once we do it, once we have it in the position, we pull this, go towards the clockwise, and what will happen in our implant, in this case I'll show what happened in the 24 millimeters expands, like the wings expands, having a good grabs, grabbing really well towards the sides of the tunnel, creating a strong pull of a strength of 1245 newtons in the aperture of the femur. And after that, what we do, it's the fixation in the tibial tunnel this time. We just to remember, all materials are PIC, and you're basically not having anything metal here. Okay, so after we have that done, and we will unsuture cleats, unsuture the suture from the cleats, and after that, when we have that ready in the tibial tunnel, We will pull this out. I'm sorry, as I say, it's not working. We will use our instrument to just to pull, to keep some tension of our graft out. After that, we will put inside the shield that will put some compression towards the walls of my tunnel in the tibia. And then after that this is inserted, we will find our peak, our peak to close it. We screw it, and this is gonna be against our, the screw will go the way in, and the shield's gonna go in the space of the tunnel, compressing our graft against it, having a really great strength of pull, 1479 newtons for pull out of strength. What we have here also, the 24 is what assimilates what happens in the tibia. That's what I'm trying to show. It's the graft is compressed to the tunnel, and it's great, and we can assimilate it to the this is the closest one to simulate the ACL. On the other hand, what happened when you have a torn ACL, usually happens our meniscus is the tear in the meniscus. Then we have our crossfix. Have a straight or curved needles. In this case, it's curved, 3 millimeters apart from each other. When we it's all inside, it's all suture. So if for some reason when we fired the device and it wasn't located, a misfire or something, it's simple, just pull out of the suture, and we don't have to find any device. With this product, we have the inserter. We will measure how far is I want my needles to go inside, so we can move it according to what the measurement of the injury where we have to fix. We will slide it all the way to the meniscus, and what you will do after it's located properly, you just fire the device and pull it out. You will find a knot already. You just pull it all the way, the knot is already made. Just pull the white string, and once you feel is where you want it to be and you want to close out the knot, then pull the black one, and after that you will insert the push or suture cutter all the way down and cut it, and that's it. We will have fixation, and we will have the repair for our meniscus. Very simple, and our ACL repair as a perfect system.